So exciting. All right, my name is Mike Willman. I'm with the Nonprofit Development Center of Southern New Jersey, and this is, I believe, the 13th in a series of Zoom sessions, uh, which the center has put in motion subsequent to its region-wide nonprofit summit in March of 2024, in anticipation of its third nonprofit summit in March of 2026. And what we're doing is looking at subject matter areas that were selected by the people who met in March of 2024, education being one of them. All of them have amazingly broad, I guess you would say titles, health, housing, education, whatever. Uh, but that's the way the discussion unfolded at the summit. So what we have done is tried to recruit subject matter experts to help structure and lead a discussion about each of these areas in the hopes that we will find some consensus about recommendations that we can make, initiatives we can undertake, legislation we can support, things we can advocate for, that will support our goal of having South Jersey become the most nonprofit-friendly region in the country by 2030. So today's session is on education, one of those, you know, unarguably, inexplicably huge titles that covers everything. So we have two subject matter experts, one focused on the what I'll call the K to 12 and the other on higher education. Uh, you see their pictures there. These pictures have been heavily airbrushed or filtered or whatever. I don't recognize either of the women from these pictures. A terrible attempt at awful humor. So what we're going to do is have them set the stage for us. What we want you to do is talk to any friends you have, any colleagues, discussion, because we will have two more sessions. Uh, the recording of this session will be made available to all the people on the NPDC list. And we encourage you guys, as the subject matter presenters, experts, to make them available, make the recording available to anybody you think would benefit from it or might be seduced into being part of what we're doing. So that's the prologue. Michelle, if you would make, I don't know who you want to make Mary Jean. I think she has the PowerPoint, the host, and we will go from there. We're delighted to have you all. We are very appreciative, Dr. Moody and Dr. Strong, of your willingness to help us on this. We look forward to the discussion. We look forward to the final report, and know that we are truly appreciative that you are joining us in this effort. Okay. Mary Jean, I think this brings it up to you.
Yes. So my name is Mary Jean Strong. I am an elementary literacy coach in the Lindenwold School District, where I serve kindergartners through fifth graders. And I'm also director of the Magic Seeds Project. That is a nonprofit in South Jersey where we give books and literacy information to families of little ones through our book bundles. And Dr. Moody, if you'd like to introduce yourself.
Hello, I'm Anissa Moody. I'm a psychologist, a counselor, clinical psychologist, and a higher ed professional. I've been in college, communities, academic settings my entire life, either as faculty or working in health-related systems, developing health systems, helping colleges to meet the needs, the whole needs of students.
Okay, so with that, we'll get started.
I have one major thought. We have a very small group.
Yep.
So we could definitely be a little bit more conversational too, and that might also help with time.
Okay. And how would you like to do that? What are you thinking?
I'm thinking we could present information, but also invite anyone or who wants to talk, join, or ask questions as we move through.
Sounds good. Sounds good. So if while I'm presenting, you can just kind of look at the chat and if see if anyone wants to join in and just give me a holler. That would be great. So today's goal is to identify and discuss challenges in education, both K-12 and higher education. And as Michael said, the field of education is so broad and encompasses so many. And when we look at the challenges, they are so broad and so many, but I really wanted to center on 3/4 today: poverty, chronic absenteeism, and smartphones and COVID's effect. I looked at the research in these areas, I looked at the formal surveys, and I also had the opportunity, because I knew this was coming, to speak to colleagues, teachers, fellow teachers, administrators who work in various districts throughout South Jersey to get their thoughts on these issues as well. So I will sprinkle in some of what they shared with me throughout this time. So to start with, poverty. A RAND organizational survey of American teachers asked teachers about a range of problems that affect students, and 53% of the teachers said that poverty was a major challenge in their school. And in that same survey, the teachers who worked in high poverty schools, almost 3/4 said that the academic performance of their students they rated as poor or fair, and over 60% of them rated as poor or fair chronic absenteeism and behavior as well. When we look specifically at the state of New Jersey, the percentage of students who live in poverty is about 13% throughout the state. Now, the term poverty is defined as living below the federal poverty level, which is $29,678 for a family of 4. So this level affects approximately 13% of our kids throughout the entire state. The rates are disproportionately higher when we talk about our Black students and Hispanic students. And in looking at children who are under the age of 5, the rate of poverty is slightly higher. And again, disproportionately higher for our children under 5, for Black children where the ratio is 1 out of every 4, and Hispanic children where the ratio is 1 out of every 5. And if we take a look at this map is geared towards children who are under 5 who live in poverty. The highest levels of poverty are seen in Cumberland County and Passaic County, Cumberland, of course, being in South Jersey. And when I reflect on the levels of children below poverty, looking at those statistics from 2022, so the map shows the children under 5, but then when we talk about the students who are living below poverty level, Ocean County and Cumberland County have about 20% of students living below the poverty level. Camden County has about 19%, and Atlantic and Salem County have about 15%. Burlington, Cape May, and Gloucester County are about 7, 8, and 9%. So large amounts of our kiddos, about 20,000 of our 5-year-olds and under are living in poverty, and about 54,000 of our 5-year-olds to 18-year-olds are living in poverty, and that is just in South Jersey. Some of the correlates that are associated with living in poverty: less access to safe, affordable housing, inadequate nutrition. And poverty is obviously a very complicated, complex, multifaceted area. And so it involves a lot of stressors. These are just some of them. So the stressors themselves cause problems, but the chronic exposure to stressors cause problems as well. Because when stress hormones run constantly through bodies, it has very big effects on brains and bodies. In particular with brains, children who are exposed to a large amount of stress hormones, their ability to learn is impaired, their memory is impaired, and also their executive functioning, their ability to plan, their ability to pay attention, their ability to not be distracted by things is affected. And also the health disparities among kiddos who come from low-income houses and kids who come from high-income houses. Those health disparities start from before the children are actually born. Babies are more likely to be born preterm in low-income households. It affects them as children. They're more likely to have chronic diseases such as asthma, and even as adults living in poverty, more likely to have stroke, chronic heart disease, and cancer, autoimmune diseases as well. And when we look specifically at our kids coming in and starting school in kindergarten, ready to go, children who come from impoverished houses are more likely to have lower scores on school readiness assessments. Vocabulary, that school readiness encompasses vocabulary, communication skills. And those two pieces alone are a huge part of how easily a child is able to learn to read, but also knowledge of numbers, the ability to concentrate, and cooperative play. So as you can see, the correlates of poverty affect education in many different ways. So as for possible solutions, and again, we're focusing on education because poverty affects so many aspects of life, but this talk is really geared toward education. There are interventions that really talk to parents of young children and the importance of that secure attachment from when they're born, the importance of being responsive, of being helpful and attentive to them, because if they can form a strong, secure bond with their child, that actually is going to weaken the association between socioeconomic status and negative outcomes for their kids. In a longitudinal study done in Minnesota a few decades ago, it was a while ago, but still interesting, a longitudinal study took women who were having their first child, who had low socioeconomic status, and they followed those women for many years until their children graduated high school. And they found that the kids who were most likely to graduate from high school had parents who were warm, responsive parents. That parental care was more predictive of graduation than IQ and achievement scores. So some interventions really work on that end, that when the children are very young. And the teachers that I talked to really talked about this. They said that their kids who do really well, even though they have challenges at home, who do really well, are the kids whose families are supportive of them, encouraging of them, understand that they're trying their best, understand that they don't have to be perfect at everything, but really love and support them no matter what. Support from schools in the state, quality early education, childhood education is super important, as well as making sure things like bellies are full so they're ready to learn. New York State has just adopted free lunch and free breakfast for everyone, that all kids are ready for the school day. And of course, welcoming families in school, making them feel like they are partners, that they are the partners that they are, that is so very important. And finding out what their concerns are and addressing those concerns and needs. And then the physical needs, a lot of community resources. I know I've packed backpacks before with new school supplies to hand out to kids. I know some schools do haircuts and have coats ready for kids. So addressing those needs so that kids feel prepared. I love the look in their eye when they get a brand new backpack. They're so excited and they feel like they're on par with all the rest of their class. So those are some of the issues that come along with poverty. So our second issue is chronic absenteeism. And about 14.9% of K to 12 students are chronically absent, meaning that they miss more than 10% of the days at school. So that's about 2 days a month that the kids are missing. Pre-COVID, it was closer to about 10.6%. It has come down from school year 21-22, but it's still not quite where we'd like it to be, of course. And it's higher for some student groups than other groups. For example, grade-wise, pre-K kids are more likely to be chronically absent. That chronic absentee rate is about 33%. And in 12th grade as well, it's high. It's about 21%. Other groups of kids who are more likely to experience chronic absenteeism, children with lower incomes, are 4 times more likely to be chronically absent from school. And that accounts for about 25% of the achievement gap between high-income students and low-income students. Children of color, children who are special education students, children who identify as non-binary, are multi-language learners. And the students that have the highest rate of chronic absenteeism are students who are experiencing homelessness. About 40% of those students are chronically absent, and children in foster care. About 27% of them are chronically absent. So some of our very vulnerable populations are experiencing chronic absenteeism. I wanted to share this with you. I know this is from 2016. But you can see, so if the national average was about 10% back before COVID, we still had lots of counties that were higher than that. Of the 8 counties in South Jersey, 6 of them were higher than that 10.6%. And Cumberland County, which had the highest rate of poverty, also had the highest rate of chronic absenteeism. And just for fun, I went into the school report cards just to see. I picked 5 South Jersey districts that have a poverty rate of higher than 54%. And I wanted to see their chronic absenteeism rate, if it was approximately the same amount. And the range was shocking, actually. So 5 South Jersey districts with poverty rates above 54%. The range in the percentage of students who were chronically absent ranged from 11.5% to 46.9%. So some schools have done a really nice job of figuring out how to make sure that their kids are in school every day, which we know is super critical. In looking at some of the reasons why kids are out from school, researchers have classified it into 4 different categories. Barriers to school, meaning food insecurity, transportation. Sometimes the kids need to be home to take care of someone older, someone younger, or they have to go to work to raise money for the family. It could be an aversion to school, whether kids are struggling academically, whether they're struggling with anxiety, disengagement. Kids are not challenged. Kids who are experiencing harassment, intimidation, or bullying may be disengaged, or kids who feel that their school is culturally unresponsive to them and they don't feel like they fit in or they have a place. This last category, misconceptions about the purpose and benefits of school. This has been bigger post-COVID, and the thinking of this category is for families who don't necessarily prioritize coming to school every day, and that these children are absent quite a bit. And looking at correlates of chronic absenteeism. Low academic achievement, which makes sense because the kids aren't at school, they aren't learning what they could be. It's especially problematic when you have kids who are struggling academically, because not only are they not getting the tier 1, the regular everyday instruction, they're also not getting the intervention that they probably were scheduled for to help them. So they're kind of missing both doses. Kids who are chronically absent in the early grades are more likely to repeat grades, are more likely to not be reading proficiently by grade 3, which is that really important marker of long-term success, and are more likely to have behavioral problems. And that predicts chronic absenteeism in later grades as well. And chronic absenteeism is the single strongest predictor if a child is going to drop out of school. And it's also predictive of suspensions, teen and substance abuse.
Mary Jane, can I interrupt you for a second?
Please.
You alluded to a statistic. You had picked 5 school districts, and the chronic absenteeism, I think, ranged from 11 to 40 some percent or whatever.
Yes.
Do you have any insight into what the difference in approaches was that might explain why those statistically similar school districts had such different outcomes in terms of this metric?
I'm not sure. And that's something I really actually want to look into, because if a school has more than 10% of their students chronically absent, by the state of New Jersey, they have to make a corrective action plan. And 60% of New Jersey districts are on corrective action plans for chronic absenteeism. So I really want to look into that to see what other schools are doing to be more proactive.
So the reason I asked was first curiosity because of the disparity, but second, just to emphasize that those, we're looking for a range of recommendations that we could make or support, but we're looking for a few things that we could actually, I guess, advocate strongly for, push hard for, try to find funding for, whatever. So if some school districts had perhaps not a magic bullet, but a magic something that was working for them, to know that they were doing this in school district number 7, and we could try it, see if we could duplicate it in school district number 47, looking for things that are manageable in terms of how we look at the outcomes of this conversation, and finding something that's working and trying to have it work in more places than it's currently working would be a perfect match for the mindset we're trying to create.
Absolutely. And I have on this side, I have some general solutions that have worked in different places, but what that district is doing in particular to combat this problem that is being so effective, that's what I want to look into.
Okay, maybe we could even invite somebody from that especially effective district to join our conversation.
Oh, that would be fantastic. Because I know almost all districts are working on this now, but some districts obviously are having much more success than others.
Okay,
So here are some solutions that have been put forward by different schools and researchers. Academic tutoring, asking even members of the community to come in to work with kiddos one by one, or having older kids work with younger kids. In my experience, I found that a big part of tutoring is really bolstering confidence, and by having that one-on-one time, that's really helpful for kiddos. Strong connections with families. I know one district really is working to talk to families and explaining to them the importance of coming to school, and even talking to them. One of the barriers was inclement weather, because it's a walking district, and the school was actually even handing out umbrellas to the families so that they could come to school and stay dry. So seeing what families need and really helping them. Investment in mental well-being, counseling, one-on-one, in group, setting up lunch buddies and mentors, and really working on SEL to especially help those kids who are anxious with school. Another possibility is having a therapy dog come in. I know a school where they bring in a therapy dog a couple times a year, and one kid told the principal, "This is the best day of the entire year." So maybe having that be a more regular practice, or letting the kids know when that's going to be. And the other recommendation that I saw was for staff diversity. That it's super important for kids to see good role models that share a same culture with them, so that they could make connections and feel a sense of belonging in the school. So those are some general solutions that many schools have tried, but we'll take a look and I'll see some of those districts with the lower rates and see what they are working on. Which brings us to our last.
Hello, I had my
Hey,
hand.
Dr. Moody, what's up?
So this reminds me of Beacon Schools. Has anyone heard of Beacon Schools? New York City, for many years, when they were really innovative in terms of education, had were like Beacon Schools, which were schools in depressed communities that were open 24 hours. The beautiful thing, in addition to the outcomes from the school, was that there was a lot of data collected. And one of the things that they found was, of course, because it was a Beacon school and was open, being tardy and being absent were almost non-existent. One of the things that they found that made absenteeism and being tardy down was because the students' idea of being able to connect in the morning. So there was so much space and time for social connections, and there wasn't a hard and fast start time. And you also find that in international communities too, when there's not a hard and fast start time, but what's called a communal meeting time, meaning we meet around 8:30, but before that, we get together for breakfast, we get together. The Beacon schools also echo that. Right now, there's only two of them. One is Kips Bay, and they're still really touting some great outcomes, including when it comes to absenteeism. So
Oh, that's interesting. Because I know some schools struggle with not only chronic absenteeism, like missing the whole day, missing pieces of the day. There are kids who are chronically late every day and
Right.
missing important or leaving early every day, and they're missing important chunks. So I'm wondering if something like that meeting in the morning would really bring kids in, something that they didn't want to miss, and really making sure that they're there as well.
It seems when school is your community, your family, there's a different way in which you engage.
Hmm.
Interesting.
So maybe we could identify somebody who could tell us more about the two remaining Beacon schools, and we could learn a little bit more at some point down the road.
Absolutely. Oh, if their information could help other kids get to school every day, that would be amazing. Okay.
Before you move on, Mary Jean, good morning, Debbie Duncan. Nice to have you.
Good morning.
All right. Sorry for the interruption.
No problem. Okay, so the final area is smartphones and COVID's effect. I put them together because they seem, many of their the impacts seem to, they just seem to go together. They seem to have the same effects. So while it's not a perfect match, it's there. 8 out of 10 teachers say that COVID had a lasting impact on education, period, whether it be students, whether it be instruction, whatever it is. I know as someone who has taught pre and post COVID, I can definitely mirror that. And I just finished reading The Anxious Generation, where Jonathan Haidt talks about how smartphones have affected every aspect of life, especially for Gen X, as they have been developing their brains and bodies through this time of having smartphones. So some of the correlates of smartphone use or COVID: learning loss. 81% in that RAND study said that education was impacted negatively or very negatively by COVID. We saw those results in the National Assessment of Educational Progress, that our kids in reading and math aren't where they used to be. But teachers also see this in the classroom and talk about the skills that kids don't have that they used to have, and how do we accelerate learning so we can help them and support them. Executive function difficulties. This was talked about in the book, about how heavy users of phones have problems in the executive functioning, such as they have difficulty planning, difficulty with self-control, difficulty with focus and attention, that they're constantly distracted. My friends on the beach talked about the phones and high schoolers, and how difficult it is to make a good phone policy that everyone can follow that's really good for kids. One school was putting them in pockets in the front of the room, but I was saying to them that the kids can still see them and are still distracted by them, much like if we go out to dinner with someone, we put the phone on the table. As long as that phone is in our sight, it becomes very distracting. Both phones and COVID have mental health concerns. Majority of school administrators talk about how they don't have enough mental health resources for their kids. There's a statistic from 2024 that 13 to 17-year-olds, about 34% of them are experiencing anxiety disorders. And in 2021, half of middle school students reported prolonged periods of sadness. The teachers and administrators I talked to also talked about relationship difficulties. There was an NEA survey that said 80% of teachers found that student behavior is problematic, that there are more outbursts, more aggression, that there's an increase in disrespectful behavior. But teachers especially talk about the relationships among kids, that they seem more socially isolated because for a time we were. And then now with phones, we're kind of in our silos, that kids aren't playing with each other as much. And when they play with each other and they negotiate the world, they really work on those social skills, that negotiations, those conflict resolutions. And they're having trouble with those areas, which is so much bleeding into the classroom and taking up really important classroom time to deal with all the conflicts among students. The high school teachers talked about a sense of apathy, that many of the kids felt helpless. And in the research, there is a term called flourishing. And flourishing includes 3 parameters: that kids are interested and curious in learning new things, that they're calm and controlled when facing challenges, and that working to finish the tasks they start. That's kind of like grit. So there were 3 categories. They found that 40% of 6 to 17-year-olds are not flourishing, that they're missing at least one of those pieces, whether it be interest and curiosity, being calm and controlled, or finishing the things that they start, that kids are more disengaged. And the teachers also talked about, I've heard this in a lot of different places, this fear of failure, that kids don't want to struggle, that they fear struggling and they feel failure. They don't see failure as a necessary part of learning. It's something that is uncomfortable that they don't want to experience. So they don't want to try lest they failed. So some solutions in that area, in those areas, academic tutoring. Jonathan Haidt talks about phone-free schools with extra recess, of course, mental wellness services, and teaching kids about growth mindset. The idea that they might not have it yet, but if they persevere and they continue to work on it, then they will get that. The teachers I talked to talked about making connections with kids and helping them through a struggle, and then talking about them and reflecting on the struggle. That the teachers kept those high expectations that John Hattie talks about and kept them there and helped the kids make that progress, that was really successful for the kids. Those teachers didn't want to lower the bar so that the kids wouldn't struggle. They wanted to keep the bar high and help the kids through them, which again talks to connections with students. Teachers know that there's no learning without relationships, of course, but having strong connections, culturally responsive connections with your kids, especially if they're from a different culture, learning more about their culture, asking them about their culture, sharing language cognates with them so that they feel connected and part of the school culture. So again, a brief foray into 3 challenges:
Just jump
poverty,
in real quick.
chronic absenteeism, and smartphones and COVID.
Mary Jean, I'm sorry. I do have a
Please.
question.
Yeah.
So when it comes to making connections with the students, one of the things that we've certainly seen in the college community is that it is harder and harder to build those connections. But trying to find ways to engage them, trying to get them away from their phones, even things that usually gets a response, especially with the incoming freshmen that I've seen, it's like talking to a brick wall and there's crickets in the room afterwards. So what are some ways, especially at younger ages, that we might be able to build and foster those connections early so that we actually can engage with them by the time they do reach, the college population that I see? How can we engage with them in a way that works for them? I know you said, consider culture, but what about the culture of the generation that we're seeing now as a whole?
Wow, that's a great question, Jill. I know you talked about younger kids, but I'm going to share one thing that I heard about older kids. A strategy that I've heard and that I've tried. I went briefly into middle school for a semester, and whew, that was a wake-up call right there. one strategy that I heard about talked about noticing kids, not asking them, not peppering them with questions, but just noticing pieces of them like, oh, I noticed that you wore an Eagles jersey, and kind of letting it go. Finding little pieces, but not demanding much of them to respond, and doing that over a period of time to kind of to get that relationship. That was one strategy that researchers have found. Um, with the little guys, I love to ask them questions about their family. I love to ask them the question, well, what do you want to tell me about? Or what are you excited about? And notice what they're interested in. Sharing books. I find also that like sharing my enthusiasm, or when teachers are excited about something and kids learn about it, that they become excited about it, and helps them to kind of open up and to discuss. And I'm very mindful of including in classes all the students. We have a large portion of kids who don't speak the same language, and making sure that they're able to communicate, that they feel comfortable, and finding ways for them to share, which may not be them talking out loud. It might just be them gesturing, or thumbs up or thumbs down. It's a long process, and for some kids they want to tell you everything. And we try to give those kids time. But it's trying to figure out what they like, trying to share your life and interests with them, and watching them carefully to see what sparks them. And it must be incredibly difficult in college. I can't even imagine. Are there any strategies that you have found, Jill, that have been successful?
I think a big piece of this is COVID as well. Um, the kids that have been coming in are really the ones who were impacted developmentally in terms of the interactions they should have been having, in their grade school experience.
Yeah,
So, starting kind of fresh, practicing those early skills of how do you join a conversation that's already happening, right?
yeah,
How do you express interest in being friends with someone? And, it's been fascinating to see that again, these are things that, we take for granted and we've taken for granted throughout the elementary through high school experience.
yeah,
So kind of starting earlier at this
yeah,
point, and like you said, connecting with them on even something small that they might enjoy. Uh, Sometimes they like our enthusiasm and sometimes it's a blank slate, which is fine. But not being deterred and being willing
yeah.
to kind of meet them where they are has certainly helped.
Yeah. And a lot of our teachers, I mean, it starts honestly first thing in the morning. It's how do the kids want to be greeted? They tell the teacher if they want a high five, if they want a hug, if they, whatever they want. So when teachers start to know their kids better, they can tell when something's off, something's wrong, and they need to step in. Another thing that we've tried at school is kind of like to take the academics out of it for some moments, and do things like have board game days where they have to interact with each other and talk and negotiate things, but it's not over, like microbiology or something like that. Just have those fun opportunities. And sometimes you learn things or are told things that you wouldn't have in the classroom setting. So making some informal kind of playtime, I find helps to connect with kids as well.
So I'm aware of the conversation, and Debbie has a comment in the chat too, but I just will add quickly, and Dr. J knows this. I also think it's important that we flip like we flip these resolutions. What do I mean by that? Um, as the older generation, we oftentimes lean into what we believe to be what should happen. But I also think that, we have to also recognize that we can't stop progress, shifts, and changes. And I find that ways in which we lean into their ways of being, and I'm not exactly sure if I have the answer yet. Sometimes I hear students will give me, little snapshots of things like in their family group chat, they talked about difficult concepts, or their parents were able to get them to do something by sending them a text. So I don't know what that looks like in an educational context yet, but I do recognize that on some level, we're really pushing a boulder up a steep and muddy hill when it comes to phones. So Debbie, I see you have a comment here.
Yes.
I one school that I went to, which was kind of fourth to seventh grade, like that. Um, it was a private school, and one of the things that the teachers did a lot was not so much, they'd give us a problem and say, go home and figure it out. And we come back in the next day, and the teacher started with, okay, what were you able to figure out? What did you figure out? What did you figure out? What did you figure? And then each person popped up with something. Okay. Now, not all of it was accurate or needed, but that didn't matter. He put it up all up on the board, and then he said, okay, together you've solved this problem because you thought of such and such, and you thought, and it pulled it together where you're sitting there thinking, oh, geez, I couldn't do this. Okay. And it's suddenly, okay, I didn't expect you to know the answer. All right. And also that, and here are the different ways that you, in a positive way, you all thought about stuff that was a step in that direction. And the other thing that they did a lot too was there may be more than one way to solve this. Okay.
Mhm.
Again, getting away from the right answer,
Yeah.
and you find a path, and that incentivizes the learning, the struggle, the thought, without this shaming of, which I see it's just so pervasive. Oh, well, that's wrong. That's not right. Okay. And this is something that I feel, and I see it all generations, in a work setting. It's not just, this is, when people are out of school, but this is pervasive, and it's in parenting, and it's in schooling, and it's in scouting, in all around us. And this is something that I feel is very, very destructive. And the more we can get people engaged, get kids learning that, just what you were saying, and is learning the challenge of learning. Okay. It's work, but it's rewarding, and it's exciting, and it's, it stretches you. And there's a lot of satisfaction in that. And I think sometimes too, we don't recognize that even young children, uh, need that sense of, oh, wow, I accomplished this.
Absolutely. I know the instructional coaches in my district, we have shirts that say yet. So we're working with teachers and with kids that you may not be there yet, but you're going to get there. We're really working on that growth mindset, so that failure is just a regular part of learning.
And their grading systems that, I know my nephew, when he was in school in New York City, I struggled, but I appreciated it, where his grading system would have not yet and why. Not yet. I wanted to, what did that mean? But recognizing that does foster a level of, I can still do it. It's still available to me, and it's still accessible.
Yeah.
Yeah.
Okay. So Dr. Moody, I have talked and talked. So I'm going to flip it over. Just tell me when to switch.
Yeah. So there's a lot. We have, how much time do we have, Michael?
We have, in theory, 14 minutes. There's nothing magic about the hour limit, but by that I mean an hour and 5 minutes is fine. We're trying to keep all these in a framework so that somebody says, oh, I could spend an hour and look at this video, as opposed to, oh my gosh, I don't have 3 hours to listen to a bunch of people I never heard of talk about.
Yeah, my time frame is tight, so I do have 12:30. So here's what makes sense to me. What makes sense to me is this conversation has really leaned into the mental health aspects of education overall. So I'll emphasize that area and those points. And it's so relevant because we're talking about higher education today. The initial goal was to really talk about several issues relevant to higher education in New Jersey, looking at the regional differences. But I'll start off by saying, can you switch? First of all, New Jersey has so much to be proud of. Um, in so many different areas in educational markers, New Jersey is at the top of the chain. Graduation rate compared to the rest of the country is number one in many areas. In terms of students' engagement, motivation, college completion rates, going to college, New Jersey is right up there at the top of the chart. However, we do see that there are areas and are some differences. And we find that in South Jersey, that there are some areas for growth. So as you can see, and I like to use Rutgers in our educational setting, and like next week, we're going to have, I'm at Rider University right now. We're going to have our beginning of the year where we look at admissions data, we look at who's coming in, where the students come from, 2-year schools, 4-year schools. And then we also talk about, briefly what happened to our students from the previous year before. And we oftentimes use Rutgers because they hit all the markers in Jersey as a comparison point. And as you can see, there's slight differences. And we tend to use in education the 4-year graduation and 6-year graduation completion as a measure, because as you can imagine, there's a big difference between a student who's able to graduate within 4 years versus the financial burden, costs, and possibly a lot of the social stressors and outcomes that are related to graduated in 6 years. Also, the implications for 6-year graduation have a lot to do with possibly students who may have participated in community colleges. Now, some of you may be wondering, there's a 6-year completion rate at community colleges. No one is looking at them like, what, really? Keep in mind, and this is another great thing about New Jersey, New Jersey's community colleges are not only home to associate's degrees, but they also have vocational programs, specialized vocational programs. For example, Mercer County Community College has I think is the only aviation school that trains many of our pilots in this country. So when we're looking at these rates, there are slight differences. As you can see with South Jersey, it's a little bit lower, but I think it's achievable. And over the years, in general, along with growth in the United States, college graduation has increased tremendously, and New Jersey has continued to make gains. And I will stress, over the last few years, given the amount of aid given from the state to a lot of our colleges to support students who are most vulnerable, we're also seeing a lot of gains in education and graduation rate as well. Can we move forward? Yes. So the areas that I'm going to briefly hit on is the equity gaps, mental health area, and go from there. So equity gaps are pretty important. When you're, can you move forward? Thank you. When any college these days is looking at a student and graduation, we recognize that everybody goes to college. What I mean by that is 30 years ago, 20 years ago, not everybody went to college. And for many different reasons, circumstances, the American with Disabilities Act, family expectations, programming, different groups of people recognize the benefit of a college education. Different people go to college, and colleges recognize that they need to provide supportive resources. So a key piece of that now is acknowledging what are the barriers, what are the limitations to people not only graduating, but also just accessing the system in a way that makes it likely that they're going to finish. One that comes up on the list often is race, ethnicity, and socioeconomic status, which are oftentimes tied for, I think, very obvious reasons that someone who's marginally educated can understand. People who are more vulnerable, disadvantaged, are typically less likely to have the resources, to have access, to participate, and to complete. In New Jersey in particular, one of the things that we see is K through 12, like Dr. Strong was saying, K through 12 preparation makes a huge difference in terms of being able to go all the way if college completion is at the end of the finish line. Having access to certain types of rigorous coursework, to having appropriate a mentorship, having appropriate advisement in high school really does make a difference. Right now, what we see, and we can speak to this, I think, Dr. J, is many of our students are first generation college students, and all of the issues that I just discussed are oftentimes present within the students. And then you add all of the emotional, the belongingness, the expectations. College and participating in college is a club. I say this to people all the time. It's a private social club where you have to learn the rules. And a lot of times, a lot of the work that we're doing with first generation students is helping them to understand what the rules are. And also socializing communities to be able to create environments where those students can feel safe and engage in those systems. Geographic and institutional access, very plain here. South Jersey, yeah, is that's okay, is less densely populated by public institutions. New Jersey overall has a lot of colleges, but just less densely populated, which means that students are most likely going to participate in more of a commute, especially when you're looking to participate in specialized programs. Campus resources, some students recognize that they need to engage in schools where they have more social resources and social support. Not all schools, and especially in this age of where we're cutting resources, which often happens from social support networks, a lot of students may again have to engage in longer commutes in order to get those resources. Disability and neurodiversity, that's my world. Right, that Dr. J is actually our disability and neurodiversity expert. And we recognize that for many students, again, with the shift of the ADA guidelines and rules, schools now have the onus to provide supportive services to everyone. And that's wonderful. But it also means that schools have to be equipped. Ryder is lucky to have psychologists who have specialized training and experience with working with students who are on the spectrum. I'm sure you know New Jersey has the largest number of individuals who are on the spectrum, not because they're born here, but because people move here because the resources are amazing. So having staff who know how to provide specialized support really does make a difference. And systematic and environmental factors. When I always say to people that one of the biggest privileges that most of us experience that we don't recognize is who you were born to, which oftentimes engenders where you live, right? Your neighborhood, the quality of foods that you eat, the connections, not to mention all of the emotional stuff that we're going to get into next. So wellness infrastructure gaps. Any higher ed professional who does not tell you that right now in higher ed, we're all facing mental health issues, especially since the pandemic, they don't know what they're talking about. The modern day student presents to college as a whole person. I think that's wonderful. Of course, I'm a psychologist. I see the whole person and I want to engage the whole person. What do I mean by that? There was a day and time, and I think all of us are a little long in the tooth on this. So we recognize this where we went to college to learn. We didn't have expectations that our professors would meet us not only intellectually, but socially, emotionally, that we would expect to have certain social norms, to be looked at, seen, thought of in certain ways. Now, of course, it would have made a difference in possibly many of our quality of lives and our experiences, but we didn't have that expectation. Today, there's diversity not only in terms of just race, ethnicity, and all of that. It's in terms of learning styles. It's in terms of how you expect to be treating. It's in terms of your education, your environment. all of these things make a difference in terms of students getting to the finish line. And with colleges being in such a precarious place in terms of emotional funding and economic strife, they need students to get to the finish lines. So one of the things that we recognize is that schools who are understaffed, with especially with mental health services, oftentimes struggle in terms of retention rates. Schools that don't have integrated health systems. I'm sure you recognize that along with mental health, we're also talking about having their health, their learning style, learning needs, behavioral responses, and also, I think Mary Jean hinted at it, the role of poverty. Economic injustice can be corrected and is oftentimes addressed in college campuses. What do I mean by that? Um, Colleges recognize that students, especially if they live on campus, if you're hungry, well, we can't have you there on campus not experiencing any nourishment. So many colleges, our college does, we have a food pantry. Most colleges do now. However, again, we do find that in certain locations, certain colleges still struggle with the idea, and it is a cost, a burden. We are lucky that we have different grants and different community members that support our food pantries. Part of the support of getting students to the finish line, I like saying that because I think that's really what it is for a lot of us now, is a race to get them there, is students having um, prevention services on campus. So we run our prevention services at Ryder. What do I mean by that? We have a robust outreach staff that provides information, resources, support to students throughout the campus regarding their health. That'd be physical, mental, sexual health. Um, we are very much so the branch that makes a lot of the referrals and connections for students who might not even recognize that much of their academic experience, they've struggled from a learning disorder. So we're very much so involved in the preventive side. But due to lack of resources, again, you may find in many places schools are reactive, which oftentimes means that they're responding to student needs when they're failing, when they're on their way out, when they're struggling, when there's a significant behavioral issue. This also, I think, bleeds into the conversation about what belongingness. As the world has been changing and struggling in terms of understanding what, dare I say, DEI initiatives mean, one of the key pieces of DEI initiatives is increasing a student's sense of being part of a community, being connected, understanding what the expectations are, and feeling as though they can meet those expectations because they belong. That is a huge piece for many students who, especially for students who are first generation and are learning about what it means. Thank you, Debbie. And learning about what it means to be a successful college student, to be part of the club, whatever that community is. All right. So I'll stop there, recognizing the time. Um, is there any questions or any areas here that anyone want to expound upon? I'm looking at you, Dr. Celeste, because I know this is some of your work as well.
I mean, Dr. Moody, I think you always say it very well. I agree. Sometimes, especially, we've been fortunate to have the grant partnerships that Dr. Moody was talking about, but recognizing that funding in the mental health areas has been interesting recently and will probably continue to be interesting. So recognizing, and this goes back to what Dr. Strong was saying, the different ways to interact with our students, the different ways to connect with them. Sometimes, and one of the beautiful things I think that we do at Ryder is recognizing the holistic person. It doesn't always have to be sitting in a therapy session one-on-one talking. We are fortunate to have a community garden we can have our students walk through, connecting with them on their level in terms of different types of supports, especially if Maybe the cultural stigma around mental health is still there, being able to use such things as virtual reality therapy, weighted blanket therapy. Again, it's different ways of trying to connect them to resources that work for them, um, recognizing that sometimes budgets are tight. It takes a little creativity, but it can certainly be done. And, that can also help with the preventative aspect of an approach.
And what you just reminded me of as a solution too is I briefly looked at some of the South Jersey schools and recognizing that it's more of the community colleges that don't necessarily seem to have a well-defined wellness program, even in the primary care areas, meaning health services and counseling. For example, I looked for sensory centers, sensory rooms. I didn't find many. I wonder how the community can support them in developing those areas. We recognize now that having supports for students, direct supports that doesn't necessarily have to be sitting in a room with a therapist, makes a difference, especially since we recognize that neurodiversity is such a huge, huge factor in New Jersey. So I'll stop there.
Okay. Well, number one, the presentation was great. It was helpful in the extreme. And I will say, not to diminish its impact, a great beginning. What we need to do now is find a way to expand the audience for this conversation, the participants in the conversation. And we can work on that. I would ask you guys to work on your end to encourage people that you know to at least let them know about future sessions and whether they can participate, you know, face to face online, as it were, or if they have thoughts they want to share, anything that enlarges our understanding of the what the problems might be and how to address them, and particularly focused on places, people, situations where the problems are being addressed with some measurable success. So we can paint as complete a picture as possible. We don't have the expectation or the resources to say that we can respond on all fronts. But if we find out that in X school, giving everybody a Dunkin' Donut in the morning has worked, you know, let's do it. I mean, I was thinking as y'all were talking, especially about the growth mindset. Uh, I coached a number of youth sports for lots and lots of years, for decades. And one of the things I realized was not only how the age of the particular athletes matters a whole lot, but at the youngest ages, the idea that you, Mary Jean, have made progress from yesterday.
Mhm.
You know how to pass the ball with the side of your foot or something, and doing something to recognize that so that you can go home or go, to wherever your happy place is and say, hey, coach said I'm getting better. Not that I'm, you know, good. And there's so much pressure in youth sports. And I think it's the same pressure that you see in the classroom,
Mhm.
the recognition, oh, Mary Jean is smart. Oh, Anissa is dumb or whatever. And they're finding ways to, I don't know, just recognize growth. And yes, I realize there's an end game for everybody, but if there's some recognition that makes me feel good, that it at least begins to address the fear of failure. No, I didn't fail. I dribbled better today than I did yesterday. Uh, just a random thought. So what we want to do, and we'll do this offline, is decide when we will have our second session. We'll try hard to, thank you, Anissa. We'll try hard to increase the number of people involved so we get even more opinions. The presentations you guys made in terms of the research you did and the way you framed the issues was terrific. Everything we expected and more. So thank you for that. Michelle, any closing thoughts before we stop recording and move on with life?
Well, yeah, I mean, I'm going to stop the recording, but just that this recording will be posted up on the website too, so maybe that will draw, a bigger audience the next time they can watch this and see what the discussion was about.
Okay. Mary Jean, thank you. Jill, thank you for joining us.
Yes, thanks, Jeff.
Always good to see you, Michelle.
Thanks, Mike.
Day after day, hour after hour. All right. So we'll continue the discussion, and great job.